Good morning, everyone. We'll be starting just in a few minutes. Thank you for joining us. Hey, Tom, I think the presentation's out of the chat. If you could re-download it. I think when we were in the practice, it doesn't translate over.
Got it. We will add that back now.
All right, thanks. Hi, June. Did you have a question? I see that your hand is raised. Okay, maybe not. All righty, let's go ahead and get started. Thank you everyone for joining. I'm Babette Friedman, the president of FPHRA. So I'm excited to see everyone. The presentation is available in the chat, so you can go ahead and download it. If you don't download it now, I'll send it out afterwards anyways. During the presentation, you can go ahead and write questions in the chat box. At the end of the presentation, I'll go ahead and read the questions to Tom. And as a reminder, we have our registration open for our FPHRA conference this year that's in sunny Boca Raton. Pre-conference is July 30th and 31st, and then the conference itself is August 1st through the 3rd. So if you have any questions, reach out to me or go onto our website, fphra.org. Now that I have that out of the way, today we have Tom Fulmer, and he is presenting on simplifying employer drug testing in challenging times. Tom has a quite unique background. He has an accounting degree from the University of Alabama. He is a former tennis pro, and he has built 4 companies between 1994 and 2015. Tom was a professional speaker and the owner of a corporate training company where he trained thousands of people across the country in sales, effective communication, and even the more popular, especially in HR, dealing with difficult people. Tom currently serves as the Vice President of Business Development for National Drug Screening, a nationwide leader in drug testing and top provider of drug testing software and employer and collector training. In 2017 and 18, his training program won HR.com Top 10 Best Customer Service Leadership Training Program Awards. And in 2018, he won a Top 10 award for Best Sales Leadership Training Program. Tom also conducts training for employers and industry partners on a variety of both business and industry specific topics. Tom will also be speaking to FPHRA members on April 13th. So go ahead and sign up for that, and I'll go ahead and pass it over to Tom.
Excellent. Thank you so much. I appreciate that. And I appreciate the opportunity to be with all of you here today. As Yvette said, I will be happy to take any kind of questions that you have. I'm here to help you and answer anything that I can, either during the presentation, and I'll provide some information so that you can reach me even afterwards if you have additional questions. I know it's kind of a short time frame for an hour to cover a lot of different topics, but we are going to hit quite a few different ones. These are the things that we're going to go over today, and not necessarily in exactly the order, but these are some of the topics we're going to cover. And that's employee-employer challenges, some of the things that you deal with on a day-to-day basis. Collection site challenges, something that's been an ongoing situation. Looking at alternate specimen types, such as hair testing, oral fluid testing as well. Some of those changes are on the horizon, and some are available currently. We're also seeing, some things with substance abuse on the rise. You're going to see some things referencing that, throughout today's webinar. And we're also going to talk about testing expanded panels, some of the things you may want to consider, some of the things that may happen if you decide to test for expanded panels, meaning additional drugs in the test panels. And then we'll touch on some legal issues, regulations, societal pressures, and how that's influencing some of the things you have to deal with on a day-to-day basis, depending on where you are. Obviously, being in the state of Florida, we are somewhat insulated from some of the challenges that are going on across the country. In certain areas, there are municipalities, there are even states that are legalizing drugs, that are even decriminalizing and basically promoting the use of illicit drugs. And I'm not talking about just marijuana, which is the popular topic, but I'm talking about heroin, PCP, meth, those types of things that are being decriminalized, that they're actually taking some steps that are encouraging use, which is kind of crazy. Fortunately, we're kind of separated from that, but it is important to be aware of that trend, just because it is moving in other parts of the country, and it may come to us at some point. We need to be prepared to handle that. So I'm going to go ahead and start off with some of the considerations and challenges. And you have different ones depending on what type of testing that you're doing. So when we're talking about municipalities, you have some testing that may be non-regulated, meaning not regulated by the federal government for Department of Transportation. That would be, for the non-regulated, would be positions other than, say, transit, where somebody's driving municipal buses, or, obviously we don't have subways really, but municipal buses, that type of thing, municipal transit. You have federal motor carrier, where you have truck drivers and bus drivers that are private carriers. You have delivery people doing those kind of things, and then others as well. So some of the challenges with those is that certain types of testing is required, and you don't have really much option as far as how that might be handled. So with any of your federally regulated testing, you have certain types of tests that you have to get, you have to be prepared to handle. And specifically, pre-employment, that's a much easier type of test to get done, because you're not dealing with current work time constraints, those types of things. But with random testing, which is required, post-accident testing, reasonable suspicion testing, return to duty and follow-up testing, there do come some additional challenges that are exacerbated by some of the situations we've been dealing with over the last couple of years. And those would be collection site not being available, turnaround times at laboratories, challenges actually, finding enough people to work. Those kind of things come into play. So we are going to talk about collection site challenges in just a moment. So I'm not going to go into too much of that just yet, but that's a big factor in that. One thing I'll tell you, though, with both DOT and non-DOT testing, one of the big challenges that employers are having right now is with turnaround times on drug testing results, because the laboratories are behind schedule on some of that testing due to staffing shortages, equipment shortages, supply shortages, things along those lines. Just to get split specimen cups, which ties into collection sites a bit, to the collection sites is taking 30 days to 45 days or more. You have Quest Diagnostics who just stopped doing a new accounts for oral fluid testing for new employer accounts because they couldn't get the kits. They have a couple of big accounts, but they just don't have the supplies to even be able to offer that anymore. So you're seeing a lot of different things that are happening that are lab-based that you really have no control over, what you do. So just knowing that is going to help you be able to plan better in how you're, handling certain situations. And although I'm going to be mentioning a lot of challenges, we are going to talk about what things you can do to improve the process, or to simplify that process. Another one of the challenges deals with alcohol testing, getting breath alcohol testing done, especially when you have concerns with that have been going on the last 2 years over COVID. People breathing out. Everybody's kind of going crazy with the masks. Sometimes wearing 2 and 3 masks. It's been a bit crazy there. Now, with breath alcohol testing, obviously breathing into a device created a lot of concern for people. What happens when you breathe into it? Is it being sanitized after? All of those different things come into play. Now, for federal testing, but federal government basically said you're still going to have to do testing. You don't really have options here. But there is an option for instance, breath alcohol testing to simplify that process and ease certain concerns. And that's a saliva alcohol or oral fluid alcohol initial screen. A lot of times people don't realize that that is authorized to be able to be done. So the initial screen on a breath alcohol test for, say, post-accident, random or reasonable suspicion, or even follow-up testing, the initial screen can be done with a simple strip that's put in the mouth. It's an Alco 0.02 device. And it's just basically going to tell you, is somebody have alcohol in their system that registers over 0.02? And that's actually where the violation. So 0 to 0.019 is not a violation of the DO2 regulations. 0.02 to 0.039 would be removal from safety sensitive functions for motor carrier for 24 hours or until the level goes down. And then over 0.04 would be a positive test. So that saliva test is a great way to go ahead and do that initial screen where you don't have to worry about people breathing in devices. It's a little bit easier to get done in certain circumstances or to make happen. Now, the challenge with that comes in is if that initial screen is over 0.02, it's not going to give you a final reading. And that saliva test can only be used for an initial screen. So if a saliva test is over 0.02, then within 15 to 30 minute time frame, a minimum 15 minutes, maximum 30 minutes, you have to get that breath alcohol test completed, and that becomes the test of record because that gives you, it's an evidential breath testing device, or EBT. That gives you the actual final number that you're going to be working with. So just knowing that you can work with that and working with your collection site or your providers is really going to help you to overcome some of those concerns, because that's one of the things we heard from employers all across the country for the last couple of years. People didn't want to go into collection sites for testing. They didn't want to, do things where they were breathing. There's one thing where you're sitting across from somebody, you can maintain social distance. But when you're doing a breath alcohol device, you're blowing into one that somebody else has blown into, even though you're using new mouthpieces and all that. There's just a lot of concerns. And it doesn't matter, what all is being done, the concern is still there. So just knowing the options is one thing that's going to simplify your process and be able to help you. One other situation, that comes into play is if somebody's having a challenge blowing into a breath alcohol device. We've actually seen that quite a few times where it does take a good bit of breath if you've never done that. And somebody, could have a challenge doing that. Well, doing the saliva alcohol test as the initial screen, would be a way to resolve that issue, because everybody pretty much has saliva in their mouth. So it's a much simpler process. Now, just like everything else with federal testing, someone has to be properly trained to do a breath alcohol test or to do a saliva alcohol test. That's called a screening test technician, or STT. So your collectors or collection sites that you may be working with, or a TPA if they're helping you with your services, they need to be knowledgeable on this so they can help you arrange those kind of things. And just having those in place before it becomes a problem is really one way to simplify the process, because when you know what the solution is, it's much easier to resolve that. In the introduction, she mentioned dealing with difficult people, something that's important in HR. That's one of the things I used to talk to people about. I did a course called Dealing with Difficult People, but it really wasn't dealing with difficult people. It was dealing with difficult situations. Because if you knew how to handle the situation, the people were no longer difficult because you know how to handle it. So now everything kind of comes into line. The same thing here when you're talking about your drug testing program. If you're prepared to handle it and you know exactly what to expect, what your options are, what you can do, and you have that prepared ahead of time, it makes life very much simpler in getting things done. That kind of flows over into the random testing. That's another challenge that sometimes people have is one, maybe not understanding how random testing works. And could be this would be specifically for DOT testing we're talking about for the moment. But random testing is required. So any DOT regulated employees must be in a random testing program. So, how are you going to make the selections? Are you doing it yourself? Or are you having somebody else do that? One of the challenges of doing those things internally is what happens when you have a situation like did happen. And I know just because I know the supervisor, we did training for them. And the person was selected for a random test and was sent for testing. You would seem like that would be straightforward. The only issue was the day before, the supervisor had gotten into a disagreement with that employee or vice versa, whichever way. Obviously you don't know all the details of that, but it was loud enough that a few other people overheard it as well, which obviously that's a separate issue that has to be addressed. But either way, the thought was at that point that the person was being singled out, picked on, retribution, those kind of things. And the reason I know that is because an attorney got involved, because that employee went and got an attorney and said, yes, that employee did test positive, by the way, but that they got an attorney involved. And then we got information from that saying, hey, did you do the random selections for that? Can you prove that? But fortunately, we did the selections for the company. We had a full audit trail that showed the selections were made long before that, and that the company had no input in it whatsoever. So just that level of being prepared for that made all the difference, because that lawsuit or potential lawsuit dropped right away. Again, that's according to the supervisors, what they told us afterwards. So just being prepared how to handle your random testing. Are you going to send people to collection sites? Are you sending them escorted down there? Because remember, urine drug screen, it's the easiest of all drug tests to cheat. It's one of those things you hear people say you can actually prepare for the test. And you can. Good collectors are going to eliminate a lot of that if they know what they're doing and they pay attention. They can stop some of that, but there's some things they're not going to catch. So with your random testing or reasonable suspicion testing, even having somebody escorted to the collection site is always a good idea. It eliminates the chance that somebody's trying to go to their locker, go to their car, get something to cheat the test. Another option is having people come on site, because there's always a potential exposure when you're sending somebody somewhere for a test, whether they're driving, being escorted, or whatever. Plus, you have a wait time. You have concerns about them being in a collection site with other people, depending on the kind of collection site that you're utilizing, if they're doing any other kind of testing there, or like an urgent care or something like that. So there's some options to have for that as well, where you could have on-site testing. You can have a collector come right to your location to do those. May or may not be cost effective, but if you figure everything in, the potential liability, the cost and all that, it may be your best option. The most important thing, though, is that you think about it ahead of time and you plan for it. Again, it comes down to how can you simplify it so that you know that you're making the best choices, that you've thought through the repercussions of each one, and you're both limiting your liability and making it as cost effective as possible. So having that combination, and it's different for different people, different locations, different people that are being tested. You just have to be prepared for those. Okay. Dealing with remote employees, this is also a challenge. We have some people who are working remotely. I know with our company, we have people that work remotely. More and more people across the country are having people that do work remotely. In many positions, remote work is not available. But how are you going to handle that if they're actually part of any kind of testing program, or if you need to get them tested? How would you have reasonable suspicion for a remote employee? If you're just seeing them through video, what are your criteria for that? So if you happen to do reasonable suspicion testing, one, you want to make sure your supervisors are trained properly so they're prepared for that, but also having thought through how do you handle remote employees if you have those. and if not, just employees in general, employees in different areas. What steps have to be taken for that. I'm going to kind of skip the quarantine times. That's really related to something else we're going to talk about, I think. Return to work. What happens when people are coming back to work? You have return to duty testing for DOT testing, where someone has had a previous positive test, they've had to go through a SAP process, and then they have to come back to work. Obviously, there's testing involved with that. There's follow-up testing as well as return to duty testing. And when you're talking about drivers who are regulated by federal motor carrier, you have to be knowledgeable of the FMCSA clearinghouse. You have to be able to, the employer is the one required to report a return to duty test. The employer does not report the follow-up testing except the last follow-up test, which is the completion of the return to duty testing. So there's different things that have to happen in that. And again, having that process mapped out or having somebody that you can get that direct advice from and how you're going to manage that is going to help you simplify things and make it easier for you to manage the program. Because I know in HR, you have a lot of things you're working on. You have a lot of responsibilities. And drug testing, although may be important in certain areas, it may not be your most high priority. So the more things you can do to make it easy for you or for your staff, for the employees, the more time you're going to have to do the other things you need to focus on as well. And again, whether that's outsourcing certain services, which some things you can outsource to a third party. We do that for companies all the time. But there's also certain things that you have to do internally that you have to have for your designated employer representative or drug and alcohol testing program manager to handle that you don't want to outsource. So you have a combination of those things, and how do those things, work together? Okay. Some of the things I mentioned, we're going to talk about the collection sites. That we found the collection sites and labs were a big part of the challenge. A lot of issues with collection sites being closed at one time and not another, now requiring appointments, changing what services they offer. And just to help you understand why that's the case, why would these so many collection sites be closed? You have lab-owned collection sites like by Quest Diagnostics. They have Quest Patient Service Centers, LabCorp Patient Service Centers. You have Abbott, Alere. They have a network of independent collection sites as part of their network, and then other third-party collection sites across the country. But you have to remember that many of these collection sites might only be 2-3 people. And so if one person's exposed and gets around those other people to COVID and they have a quarantine procedure in place, which I said I was going to come back to, they may have to quarantine. They may not be able to be open, or they may have to have at least 2 people there to open the collection site. And if you've only got 3 people and 2 of them are out, now you've only got 1 person and they're not able to effectively do that. So what they've done is they've tried to adapt with appointments only so they can potentially operate with less people. But that being said, when they're operating with less people and requiring appointments, that means you can't just walk in. You need to plan ahead of time. And then even then, what happens if that collection site is not going to be available? We've seen collection sites that don't have appointments for 2 and 3 weeks. And then we have other ones that have a really good turnaround times. You can literally just walk in. So, having those options available, having backups in place is really going to help you out with that as well. You don't want to be stuck and only have one option and then just not know what to do, because there may be circumstances that come up where a test is required within a specific time frame, such as a reasonable suspicion test. You don't do that the next day. That's right away. A post-accident test, again, you're looking, if you're doing a drug test based on that for whatever criteria, it's because there's a possibility that drugs or alcohol could have played a role in the accident. So those are things that are very time sensitive. And if you don't have something set up where you can either send somebody to a collection site or have a number where you can call and get a mobile collector to come out to you, sometimes it may be worthwhile to do that. Just depends on what the circumstance is. But either way, you want to be prepared to handle that just in case it happens. Wait times. Wait times, if you have appointments, doesn't necessarily mean somebody's going to get in a short period of time. Obviously, that's what collection sites attempt to do. But there may be situations where the wait times are significantly longer. That means somebody's away from work for a longer period of time, and that creates some challenges for you potentially as well. So appointments are always helpful, but you do have to take into account that may be the case. I mentioned mobile collections already. If you have any questions about that, you're welcome to ask about that. But that is available in a lot of areas. Obviously, it's going to be more expensive to call somebody out on last minute notice versus scheduling collections. So you have both options where you can schedule an on-site collection to come out, especially with random testing or with pre-employment or hiring events. You can potentially schedule some things like that to make it easier for you to manage that testing. We'll talk about just a few minutes about some of the alternative types of testing and kind of what's coming down the pike. And I know I've mentioned several things with Department of Transportation testing, so I'm going to go back and talk about Florida drug-free workplace programs and some of the things specific for Florida. So you have a non-DOT program, and this kind of before I get into the alternates here, in the state of Florida, that's the Florida Drug-Free Workplace Program, a voluntary program where you have to follow the protocols on that. It provides a discount on the workers' comp insurance. And so if you're following that program, you do have to follow the rules for that. If you're not part of that program, then Florida doesn't have a lot of restrictions as far as the type of testing that you can do. But just to give you an example, the Florida Drug-Free Workplace Program, if you have alcohol testing, that must be done with blood, not breath. That's part of the program. I know there was a municipality that was part of that program, and they were doing breath alcohol testing, and that becomes an issue because you're not following the guidelines of the program. So just be aware that if you are subject to specific guidelines, whether it's that, contractor guidelines, federal guidelines, whichever guidelines you must follow for that employee testing, you do have to follow those guidelines and be prepared to handle that. So with that, in Florida, hair testing is available. Oral fluid testing is available. Urine drug screen testing is available. Urine's been the gold standard for many years, even though it is subject to potentially cheating the test. Instant testing for urine drug testing is also available in Florida. Now, with the Florida Drug-Free Workplace Program, for instance, hair testing and oral fluid testing is not part of that program. Could you do urine drug screens? Yes, that's part of the program. Instant testing, through some of the rules, even though it's not completely codified into it, instant testing would fall under that for urine drug screens in Florida. Now, other states have other limitations out there. But just to talk about what some of these look back different, how they look back as far as different timeframes. So hair testing is only going to go back, it's going to go back from about, I'd say probably more like 10 days to 90 days. So in other words, if I'm doing hair testing and somebody goes out and does coke, meth, smokes a joint, 2-3 days ago, it's not going to show up in a hair test, at least not for 7 to 10 days at the earliest. So, but it is going to give you a look back for a longer period of time. One thing about hair testing is that like trucking companies started using it years ago because they were actually able to tell a kind of a lifestyle change of things. And what they found was that when they started implementing hair testing, the applicants changed, their positivity rate on pre-employment drug tests went down, their number of accidents went down, because the people that were going to try to cheat the drug test to get a job knew they couldn't cheat a hair test. And so you see a transition kind of in there. So we're seeing a move toward these alternate specimen types because, one, they can't be cheated, and they have different characteristics that give us certain information. So hair testing gives us a longer look back time. If somebody's abusing drugs, it's going to give us that if they've used it within the last, say 7 to 10 to 90 days. But there's some challenges with that too. The number of collectors out there. What if somebody, doesn't have any head hair or very little body hair? The turnaround times are longer. There's limited test panels. You can still do the most common tests, but not, all of those. For employment testing, that would still be fine, though. It still covers those drugs. So hair testing is some possibilities that's actually being considered by the federal government as well. Oral fluid is further ahead of that, so I'm going to go ahead and jump to that really quickly. Oral fluid's already been approved by the federal government for testing of federal employees. And the Department of Transportation currently has a notice of proposed rulemaking out to adopt oral fluid testing for DOT testing. So the benefit of oral fluid testing, well, it's going to be lab-based, first of all. While there are some instances out there, I don't know that I would rely on those at this point. Lab-based is going to be the way to go. The look-back times are fairly short, so it's really giving you more of an immediate immediate use kind of thing, 24 to 48 hours, but it will detect in as little as just minutes to an hour, whereas a urine drug screen takes at least an hour or so to metabolize into your body. So you're having different look back times for that. The challenges with that is that not many collection sites carry oral fluid collection kits. It's typically been a self-collect option for employers to be able to have on site in the case of certain circumstances when they're allowed to do that type of testing. With the DOT in the process of adopting oral fluid testing, we expect to see that change where split testing will be available now. Before, oral fluid testing was a single specimen. So what happens is it goes to the lab and it gets tested. And then they do the confirmation testing and send that back. But for DOT testing, that oral fluid has not been adopted yet. So we're still looking at what's actually going to happen, how it's going to be able to do a split test. For those of you who don't know what a split test is, it is when you take two specimens. That way, if an employee believes that the laboratory messed up on one specimen, they can request that second specimen be sent to a different laboratory for testing. That's required for federal testing, for DOT testing already. For many organizations, they already do split testing to make that available to their employees, even if it's non-federal testing. So with oral fluid testing, that's not currently available in reality, but it will be before too long. At this point, even though it's been authorized by the federal government, there's no labs that are certified for it, and there's still questions about the procedure, and it's still not being utilized even at the federal level. We do expect that to change within the next year, though. Once that does change, we expect the collection sites to start carrying more oral fluid kits, to have a more standardized process, and to have some more options. So again, something to be aware of, to keep an eye on, that it may be something that could be beneficial. A lot of organizations I've worked with, I actually have worked with in the state of Florida, a statewide organization up there has just adopted oral fluid testing. And they're able to do that across the entire state because they have individuals that can do the test right there. So they have about 50 people that are being trained to be able to do that. So it is something that's coming along. It's something that's going to be, I think, very effective, but something that you want to look at is part of your drug and alcohol testing program as a consideration. It does have limited panels compared to urine, but again, all of the test panels that's typically done for employment are available in both hair and oral fluid testing. So those are both potentially available to you there. So the DOT changes, I've already referenced that just a bit. We're seeing that a notice of proposed rulemaking out there. So if you have DOT regulated employees, you might want to keep up with what that rulemaking is and the comments. So right now we're in a comment period. Two national associations, the Substance Abuse Program Administrators Association and the National Drug and Alcohol Screening Association, have both submitted requests to extend the comment period on this. They initially had a 30-day comment period on the changes for implementation of oral fluid testing because there are some challenges. And as as somebody who's going to be involved in that, you can make comments individually or as an organization. So when you're looking at what they're proposing, you want to look and see, how is that going to affect me? Do I need to make a comment? Is this going to be good for everybody? Is this going to create challenges, what they're doing? If you don't get involved and make comments on those, if you know it's going to have an effect on you, then you're missing out on an opportunity to shape policy that could make your life easier for you. I always review all notice of proposed rulemakings. When appropriate, I make comments. I always read all the comments because sometimes I'll read it and go, okay, well, that I never thought of. That is going to be a problem. Or, hey, I never thought of that. That's going to be great that we're moving in that direction. And then I'd want to support that comment or maybe dissent from that comment. So something to be aware of if you have DOT regulated employees, that you might want to keep up with what's going on with that. You might also want to sign up just for as far as DOT changes go with the ODAPC listserv. That's the Office of Drug and Alcohol Policy and Compliance. That way you'll know what's going on and what's coming up before it happens or as it happens. So to get to that, you would just simply go to transportation.gov/ODAPC. And that would get you to ODAPC. That's the Office of Drug and Alcohol Policy and Compliance. And they oversee the DOT drug and alcohol program. And that kind of sets the standards and best practices for a lot of non-regulated testing too, just so that you're aware of that. So like I said, we're seeing the change for oral fluid testing. Not available yet for federal testing, but oral fluid is available for non-DOT testing, non-federally regulated testing at this point. Definitely an option. Can't really be cheated if it's done correctly. Can easily be administered. It's been very effective in using it for reasonable suspicion and post-accident where you're suspecting or there's a potential for a current level of impairment, because it's going to give you the most up-to-date data in the shortest time frame of a look back for that. Okay, so we are seeing substance abuse on the rise, and some of that's reflected in the testing numbers, and some of it's reflected in other types of surveys. This particular survey, of the group of people showed a pretty good increase in use. If you look at the increases there, I'm not going to read through all of those for you. The slide deck's available in the chat, so I just included it for your reference there. But we're continuing to see this as a trend across the country. And when we hear about the legalization, of marijuana, that's just kind of the doorway for a lot of things. And I'm not talking about whether you agree with it or don't agree with it or believe in it or don't or any of that kind of stuff. Just talking about the way that it's being handled by the states. They're actually creating, through the regulatory process, a protected class of people who can go out and use drugs recreationally. And that's really what I'm talking about here that's posing the most challenge for employers, not somebody who has a debilitating disease and is trying something to resolve that, but the recreational push. And all the organizations behind all of these state movements, that's actually what their stated purpose is to legalize all drugs. And this is a pathway to that. And they put that right out there. It's all public information. The media just doesn't cover that. And the reason I mention that for you as an employer, somebody who's dealing with this, when you're seeing this push to change the mindsets of people are thinking it's fine. Remember, it's an impairing effect. Nobody would be doing any of these drugs if it didn't have some type of impairing effect, some type of effect on them. So it is something that's of a concern. So you really need to keep an eye on what those trends are. And what you'll find also is, if you keep an eye on some of the studies, you'll see that different areas and different types of jobs tend to have different types of drugs that are typically abused in that area. The study by Quest, which I think the newest one's going to come out at the NDASA conference, the National Drug and Alcohol Screening Conference, is in Indianapolis in May. I think they're going to release the drug test study index there, their drug use index, and that'll have all the statistics from this past year. But if you go to questdiagnostics.com, you can look at all their past studies, and you can see by industry, by type of job, by type of drug, by type of specimen, what those positivity rates look like, whether they're going up or down, which ones detect things more than others. Some very interesting things, and that really can help you better understand your population, the people that you're working with, and what things you may need to watch out for. So we are seeing, it on the rise. We expect that to somewhat continue. Whether the marijuana gets legalized or not, that really is not affecting drug testing. It's just one thing that's either in the drug test panel or it's not. You've probably seen across the country, some states are stopping the testing for marijuana for pre-employment testing. They're barring employers from taking action against somebody who tests positive for marijuana unless they can prove they were using it on company time or prove impairment. And that kind of ties into something very important that you should be aware of. Alcohol testing is testing for impairment. Drug testing is testing for use. There is not at this time a drug test that's going to tell you somebody's currently impaired. It does not exist. Yeah, that's written into certain state laws, languages. Fortunately, in Florida, that's not written into our language here. Employers, are able to take action based on that, based on what their policy, organizational policy is. But at this point, we don't have a way to determine impairment. There are many people working on different ways, but until we actually have a legal standard, that's not going to be the case. So just understanding what it means when you're doing drug testing is very important with that, because I find a lot of employers don't understand that. They don't understand what they're testing for and what it really means. I will tell you one other thing on this is that about drug testing levels and cutoffs. One of the concerns I hear from employers quite often is they want to know what the levels of somebody's results were, whether they were positive or negative, because they think that they know better than the certifying scientists and those that make, legal policy, that they can infer by a level, whether somebody's doing much drugs, not doing drugs, or something along those lines. Just know that you don't ever want to request that, because if you make any decisions based on what you think are the levels, you're probably running into a legal minefield. And you're probably going to lose anything that gets brought against you as far as any kind of suit from an employee or anything along those lines, because you're not qualified to do that. Cutoff levels are basically telling you at a specific point in time what's the level of concentration in whatever specimen type it is once it's tested. So levels can go down. I could have taken a short acting drug that stays in my system for a very short time. If I get tested immediately, I might have a high level, or depending on the drug, I might have a low level if I'm tested immediately. 3 hours later, the level may be different. Somebody may be legally taking something and have a legal prescription. I had an employer recently said that even though it was negative, the employee told us they had a prescription. So we wanted to see what the levels were, because we wanted to make sure they weren't abusing the drug. They would have no way to know that. They would have no way to interpret that. And like I said, legal minefield there. Just be aware that if you're ever considering something like that, or you're already doing something like that, you probably want to seek some advice on how to handle that. And I only say that because it does come up at least, a few times a month, and that's just the ones that I directly hear about. So for your drug test panels, what is it that you're testing for, and what's the purpose of your testing? So there is more and more testing, for some of the expanded panels. In 2018, the Department of Transportation added or changed the definition of one of the panels. So the Department of Transportation's test is still a 5-panel test, but they changed one of the panel descriptions from opiates, which was heroin, codeine, and morphine, to opioids to include hydrocodone, hydromorphone, oxycodone, and oxymorphone. It's like your, Oxycontin, Lortab, Percocet, those kind of things. So it doesn't include all opiates or all opioids, just those that are specifically defined. And the reason for that is because, as you probably heard in the news, a lot less lately, because everything else is being overshadowed by whatever the current news cycle is. But the opioid abuse, opioid addiction, and all of that, that led people to say, okay, this is really being abused a lot. We think people are having problems with that. So that led to that being added to the test panel. Now, one thing to be aware of is that whenever you add prescription drugs to a test panel, one, you're gonna find them, but more likely, people have prescriptions for these. So as you have legal drugs that are more commonly used, it's more likely that somebody you have is going to be taking that particular drug for whatever reason. Hopefully it's a legitimate reason, and they actually have a legal prescription for it. But that is going to extend your turnaround times, because if you know a sample is going to test positive, then it's going to have to go to confirmation. And right now in confirmation testing, just so you know, we're seeing by multiple laboratories across the country, sometimes 2 and 3 weeks to get confirmation testing completed. Again, I mentioned earlier staffing issues and supply issues and equipment issues and things along those lines. So that's something to consider depending on what test panel that you're doing, if you're considering changing the test panel. Now, obviously, if you're doing federal testing with DOT, there's not an option. If you're doing the federal test, you do the federal 5-panel test. You could potentially do a company or an organization test for additional things that would be a completely separate test. So that is a possibility to be able to do that. But just be aware that it does increase the turnaround times. There's more likely you're going to have positive things on there. It's not going to tell you if somebody's abusing the drug. You're not going to get that result back on there. If you have somebody who is DOT regulated specifically, and they are taking a drug that may be an impairing effect, but if they have a legal prescription for it, you may still hear from the medical review officer about a safety concern. So just so you understand how that works, and again, knowing the process will help you understand this, is that with that 2018 change to the DOT regulations, medical review officers were now, instead of immediately issuing a safety concern about a specific drug somebody was taking, they actually had to have the donor contact their doctor, have that doctor contact the medical review officer. The medical review officer would then discuss with that doctor whether the person can perform that safety sensitive duty while taking that drug. And if not, can they prescribe a different drug? You can imagine how long it takes to get doctor's appointments now and how much of a challenge that presents. But either way, that means that you might get a negative test result for somebody, and then 5 days later, you get a safety concern about that person, and now they've been driving for 5 days, but you have a safety concern that they're taking a drug that could impair their ability to do their job. So then you have to do a fitness for duty. You have to do some other steps for that. Now, you may also have that for certain non-federally regulated positions. You may have positions in your organization that you're overseeing that are defined as safety sensitive, and that you do define that with the MRO, so that if the MRO has that job description and knows they're looking for safety concerns with that job description, then they can provide that safety concern. But again, you need to work with your laboratory, with your medical review officer, to make sure they're aware of that. Because if they don't know it's a safety sensitive position, then how are they going to know to provide a safety concern with that? What are the steps of that? What are you going to do in that situation when it happens? So these are the things that a lot of people don't take into account just because they don't know about them. It's never been brought up, or they moved into a position where that wasn't documented. No one ever brought that up to them. So if you have that kind of circumstance, you probably want to review it, how you're handling those kind of things. Okay. All right. So here are some examples. I put some that were from 2020. I just pulled a few just as some quick examples where states are legalizing recreational cannabis. Sometimes they're legalizing medical. Medical always precedes the recreational use. The more people that you have that are doing that, the more available it's going to be, and you're going to see some trends that lead into typically other things as well. You have ones that have legalized some psychedelic drugs, like DC did that, magic mushrooms, for instance. You have Oregon, who's legalized the mushrooms as well. And then you've also had decriminalization for certain amounts of drugs. And here's an example of this particular one. So in Oregon, they had, if someone has, meth, cocaine, PCP, not enough to be distributing necessarily, but they would just simply get a fine, and they can actually waive that fine just by getting a health assessment done, even if they take no action on it. So these states are passing things that are actually encouraging continued use and abuse of these drugs. And these are some nasty drugs. They have some really nasty effects that lead to, seeking behavior to actually get the high. That's what the person's focus is. There's a book by William DuPont, Dr. DuPont, called Chemical Slavery. It actually talks about the drugs changing the makeup of people's brains, so they actually see things differently. They do not see things like they normally would. And that actually leads to that kind of behavior that creates issues down the road. And again, not most people, not by any stretch of the imagination, but you do have some people that are struggling with these kind of things. And this does affect your workplace. It affects other people, because remember, if other people are working around people who are abusing drugs, there's some danger. There's safety concerns, but there's also the danger of good people leaving bad work situations because they don't want to address it. People don't want to pass on the information. They don't want to tell people. So drug testing is a very powerful tool in that regard. It's not meant to catch people. It's not meant to target people. It's meant to be a safety tool. It's meant to protect the work environment, protect people, and if it's used that way, then you're going to find it's going to be much more effective. I don't know any companies that are using it just to, quote, catch people, but that's the general mindset out there by many people. So sometimes being able to provide that information to people and setting that expectation is important. Okay, so I already talked about this. I'm really not going to go into this too much more. We are seeing the societal pressures for that, the decriminalization. How's it going to affect your business? How's it going to affect your organization? If you're doing drug testing, how does that affect your ability to recruit people? How quickly are you able to get people in the job? So we're seeing some of these things now trying to find the right people, take action right away. So there are going to be some continuing challenges. I encourage you to keep up with what's going on with that and looking at how it's going to affect you, determine if it's going to affect you, what steps you need to take, and seek out advice. If you're not sure how to handle a situation or you're struggling in a certain area, seek out advice. There's plenty of advice out there. I know we put out on our blog, nationaldrugscreening.com, a ton of information. I know lots of companies who we don't even work with use our website for state law issues, for medical marijuana issues, for employer concerns and issues, just to have resources. We put a lot of resources out there just for that, because we believe that providing that level of information is going to help everybody do better. So those are, some things that I encourage you to do to keep up with what's going on. Okay. It says keep your customers informed. It's really keep your team informed here. I put customers in there. I kind of meant for your teams. So internally, you have internal customers, which are the other departments, the people that you work with in your organization. You need to keep them informed. They need to know what's going on. They need to know what your policies are. They need to know, what steps to take. You need to keep up on training. Remember, as an HR professional, if you're overseeing the drug and alcohol testing program, your responsibility is to make sure that the right people have the right training. You should have employee education training. Employees should be educated on things related to drugs and how it can be a downside of taking drugs or abusing drugs. You should also educate them on what your policy is, what's a violation of the policy, how that's going to be implemented, so they know exactly what's going on. The supervisor should have supervisor reasonable suspicion training. You shouldn't expect somebody to be able to determine if there's some type of safety concern or issue if they haven't had any training. And just one course, one time is probably not sufficient. For many supervisors, they may go years and never have a situation that comes up. And who knows, it may be that the situation was there and they just didn't see it, or it really never happened. But if they're not prepared to handle that situation, how are you going to know that? And just like you're doing today, I mean, kudos for everybody who's doing the webinars, and for FEHRA that puts on these webinars, continuing to learn, continuing to grow, and have knowledge of what you need to do, what you should be aware of, what steps you should take, is a real big key to anything that you do. I mean, I do that all the time. I'm always attending webinars and trainings, even if I record them and go back and listen to them later, just to make sure I stay up to date on that. And the other thing is have a resource, to find the information, to get the answers to your questions. Your medical review officer, whoever you're working with for that, they really can be a wealth of information in helping you deal with situations. What happens if you have somebody that has a shy bladder situation? They try to provide a specimen. They're unable to do so. They're given extra time. They still can't do that. Well, how are you going to take the next step on that? How are you going to get a shy bladder evaluation? What's going to happen with that? What if somebody goes for a breath alcohol test and they can't provide enough breath and they don't do the screening test? Then you have to have some type of evaluation. You've got to treat people fairly and equitably, across the board. So if somebody can't do something one way, you need to have some steps in place. And, sometimes you have situations that come up that are just, ones that you never even considered would happen. Who are you going to go to get that information? Who are you going to be able to find out what the real next best steps are that aren't going to put you in danger? One of the things that we do a good bit is we do expert witness testimony, which the president of our company, Joe Riley, does quite often. And a lot of that comes from employers, or the actual case comes from an employer not following their own policy. And sometimes it's just doing something that just doesn't make any sense whatsoever. But many times it's just simply not even following their own policy. And needless to say, that doesn't go well, for the organization when that happens. So if you haven't updated your policy recently, you don't know exactly what your policy says, maybe it's time to do that. If you do have federally regulated employees, DOT regulated employees, and you haven't updated your policy since 2020, I can tell you for a fact that policy is not in compliance, because there was a change in January 2018 and then January 6, 2020 that both required changes to the drug-free workplace policy for federal testing. So if you haven't updated it or added the proper addendums to it, there's an issue with that. And if you didn't know about that, that's a whole nother issue with that. Also, any of your collection sites that you're using and you're sending people to for drug test collections, or if you're doing any collections in-house, running your own program, you want to make sure that your collectors are trained, that they're updated. The change in 2018 actually required every service agent to be subscribed to the ODAPSI listserv, because the belief was that if they're not subscribed to that, they don't get the updates. How can they know what's going on? And then that's a great point. So that means everybody, even everybody in my office, whether they're doing collections or not, we're a service agent. So everyone here is actually required to subscribe to the listserv and actually read that. We actually have monthly meetings where we actually read through the regs. We discuss parts of the regs. We discuss changes that are going on. So any of our team are knowledgeable when talking to our customers, at least enough to be able to ask the right questions. I had a question of where do I read about the changes in DOT. If you go to ODAPSI, transportation.gov/ODAPSI, you'll be able to find it there. It does take a little bit of working to find it there. But really, if you just go to nationaldrugscreening.com and you go to our blog, you'll find everything in there. Every time there's a DOT change, every time there's a proposed change, we're going to write an article about it. We're going to do a video on it. There's our YouTube channel that has some things about like the clearinghouse, for instance. I don't think there's one up about oral fluid yet. We're waiting on to hear how this latest comment period goes before we put out anything on that. But as soon as that comes out, we'll have something on that as well. So either one of those, ODAPSI or nationaldrugscreening.com, just go to the blog. You'll see a lot of information there. I will provide you my email address too. So if you want to keep updated, like with our, we do a newsletter about 3 times a year that goes out. If you want to keep updated on that, has employer concerns, DOT updates, and all that. And if there's something that comes out with DOT, we send out a special edition just on that. So that would be a way to do that. So in my email, you can email me, and I'll happy to help you out with that. Another way you can do that to keep up to date on things is be a part of, for instance, the Substance Abuse Program Administrators Association. So you're an administrator of drug and alcohol testing programs. It's SAPA, S-A-P-A-A. Their conference is coming up in Denver in August 22nd. But they put out notification, and their big focus is on education. Disclaimer, I do sit on the board of SAPA. So when I tell you that, I am a board member, I am the membership chair, so take that for what it is. But it is a great organization. If you go to SAPA.com, you'll be able to see all the information there. Again, you can email me, and I'll send you over the link to that. But you can sign up to get their notices, and every time that there's a rule change or a regulatory change, even if it's not DOT, if it's other industry-related things, they'll give you interpretations and resources on that. And they do training webinars just like you guys do, specifically on that kind of stuff. So we're always happy to help out with that. So and then the National Drug and Alcohol Screening Association, they actually have a lobbying arm as well, NDASA, and they have great resources too. So two good organizations. If you're an industry professional, drug and alcohol program manager, I highly recommend that you're join one or not both of those. If you have a chance to go to the conferences, it's really helpful, just simply for the fact, when we talk about simplifying things, sometimes it's just knowledge. Knowledge is power, but knowledge shared is power multiplied. So, when you go to these conferences, even, you have the opportunity to meet with people from ODAPSI. ODAPSI and from FMCSA, which is your Federal Motor Carrier, and all the different DOT modes. And they actually, present there, but you get a chance to interact with them. You get to see what's going on, and the laboratories, medical review officers, and those kind of people are just invaluable resources to you. The websites again would be SAPA, S-A-P-A-A, and that's the Substance Abuse Program Administrators Association, and then NDASA, N-D-A-S-A, National Drug and Alcohol Screening Association. I'm going to go ahead and pop over here just one second. There we go. You can always just just send me an email. I'll send you a list in with the links. And if there's anything else I talked about in today's training, if that's something I touched on, I know it was more of an overview, but if there's something I touched on that hit something with you and it sparked additional questions, even down the road, my email address is in the slides. Remember, the slide deck is in the chat. You're welcome to reach out to me. Just put FPHRA in the webinar in the subject line, and that way I'll know where we connected, and I'll be happy to share any resources for you. Whether we're working with you or not doesn't matter. I believe that that we all should work together as an industry to do better at what we're doing. And that just helps everybody along the way. We have safer workplaces, and that's really what it's about, workplace safety. We have better work environments and all as well. So with that, I'm going to see if we have any other questions that I did not address. Anybody would like to ask, and I'll turn it back over to Babette.
Yes, if anybody has any questions, you could type it in the chat.
Yeah, I think I addressed all the chat ones as we were going along. Hopefully I did there.
And if you could just send me the PowerPoint. Some people aren't able to load it because they have like a block from Dropbox.
Got it. Yeah, absolutely. I'll be happy to do that. I'm happy to share that. I'll send the slide deck as a PDF as well.
Okay.
That way you'll have that for everybody. And what I'll do is I'll send you over a couple of links that people ask for, and the same thing, if you want to share that out, you're more than welcome to do so.
Already sounds good. If no one has any other questions, we will be sending out the code for the SHRM credits, and we are happy to announce we're now a provider for HRCI, so we'll be sending that out as well. If no one has any questions, everyone have a great day, great week, and we'll see you next week for our benefits update webinar on Wednesday.
Thank you all.
All right, thank you, Tom.